जिसको जो कहना है कहने दो, अपना क्या जाता है। ये वक्त वक्त की बात है और वक्त सभी का आता है। हेलो डियर फ्रेंड्स, माई सेल्फ डॉक्टर श्रीकांत वर्मा, फैकल्टी ऑफ एनाटॉमी एट सेरिबेलम एकेडमी. So remember, do your hard work and definitely it will give fruit at a particular day. अपने काम को एंजॉय कीजिए, बहुत मस्ती से रहिए, बढ़िया से पढ़िए. सो इन दिस वीडियो वी आर गोइंग टू लर्न वन वेरी इंपॉर्टेंट टॉपिक, ज्वाइंट. Remember, this joint topic is going to ask definitely, damn sure, directly or indirectly in your exam. Yes, suppose any question is not going to ask directly from the joint. Can you tell me, without knowledge of the joint, can you put single step in orthopedics, medicine and surgery? No, never. So let's start the discussion over this joint topic in short, simple, sweet way. Yes, joint. What is a joint? Yes, remember there are the two bones. The junction between the two bone is known as joint. Correct, sir. These are three types. First, fibrous joint. Suppose the two bones are together connected with the fibrous connective tissue, fibrous joint. If two bones, they are joined together with the help of the cartilage, then cartilaginous joint. And if the two bones, they are connected together with the help of the fibrous capsule, and within this fibrous capsule there is the synovial fluid, then it is synovial joint. Simple. First, we are looking the fibrous joint. One funny mnemonic to remember the types of the fibrous joint. Yes, this is Sa-Su-Ji. You know, Sa-Su-Ji, Sasurji. In the similar way, Sa-Su-Ji. S for you can concentrate, sutures. Another S for synadesmosis. Next G is gomphosis. So, how you can remember the different types of the sutures? Yes, these are plain suture, squamous suture, serrated suture, dentate and shindylisis. Try to understand. In the plain suture, the articulating surface, they are parallel together and in between them there is a fibrous connective tissue. Agree, sir? Yes, the squamous suture, there is our two different bones. They are having the oblique surface and definitely the gap is filled with the fibrous connective tissue. So plain suture surfaces are parallel, squamous suture surfaces are oblique, while the serrated suture you will be able to see the bony surfaces, they are zigzag in pattern. Getting the point? And definitely fibrous connective tissue in between. Dentate suture, there is the tooth like arrangement. Strongest suture, dentate suture, you will be able to see the tooth like arrangement of the bones. Yes, the two bones, they are articulating together just like the teeth. One part is going inside of the other bone and there is the fibrous connective tissue. Fine. And shindylisis, there is the wedge shaped bone, it is getting attached within the groove of the other bone. Yes, so this is just one way to remember. Fine. Next is our synadesmosis. You will be able to see the synadesmosis when the two bones are connected together with the help of the ligament. Fine. So this is syndesmosis. Gomphosis, it is found in the gum. So you will be able to see there is the teeth which is getting attached within the gums. So the junction between the teeth and the gum, this is our gomphosis. Short and sweet way. Yes. Cartilaginous joint, when the cartilage is there, try to understand, there are the two bones articulating together with help of the cartilage, but later there is the ossification. Fine. So it is getting ossified, that's why it is also known as the synostosis. Also you can say synchondrosis. Secondary cartilaginous joint, you will be able to see the two different bones. Yes, sir. Having the cartilage, correct, sir? Hyaline cartilage is there, but in between them there is the fibrous connective tissue and no ossification occurs. This is the word secondary cartilaginous joint. Yes. Now we are looking the synovial joint. One is ball and socket. Yes, the head of one bone is globular and it is getting fit into the socket. Fine. So this is the ball and socket. Male surface is there, female surface is there, multi-axial joint. Just similar like there is the elliptical shaped of the elliptical surface of the bone. Two elliptical surfaces are there. Again, male and female surface. Yes, multi-axial joint, but restricted movement, not too much activity like the ball and socket. Saddle joint, yes, it is presenting the concave or convex joint. There is the concave as well as convex surface. Within each bone, you will see the convex as well as concave surface. This is our saddle joint. Synovial fluid will be there in every part. Plane, yes, two bones are there. They are having articulating surface plane, and in between them, there is the synovial fluid. Yes, hinge joint, one bone is there, it is fit into the other bone, but there is uniaxial movement, not the multi-axial like the ball and socket. Then our pivot joint, in the pivot joint you will see there is the one bony axis, around it another bone is showing the rotation like the C1 C2 atlantoaxial joint, superior and inferior radioulnar joint, and condylar joint where you will see the globular head of the bone which is getting fit into the other globular ends of the other bone. So this is showing the condyle arrangement, condylar joint. So this is the short and sweet presentation of all the joint in concise way. Remember, सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं, कोशिश है कि सूरत बदलनी चाहिए हमारे सीने में नहीं, तुम्हारे सीने में ही सही। कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए। In our previous video, we had seen the classification of the joint in short, sweet and concise way. So in this segment, we are going to focus the different examples. Yes, we had seen the junction between two bones is known as the joint. Yes, sir. Three types we had seen: fibrous joint, cartilaginous and synovial joint. Yes, fibrous joint, we had seen the mnemonic SA-SU-G, one funny mnemonic SSG, sutures, synodesmosis and gomphosis. Yes, one by one. Plain suture. Plain suture is found in our intranasal bone, in between the two nasal bone. Then next question, squamous suture. Squamous suture is found between the temporal bone and the parietal bone. Yes, temporoparietal suture. Then serrated suture, the zigzag suture is present between the two parietal bone. The interparietal suture is serrated suture, and the dentate suture where the teeth like arrangement of the suture joint was there. The strongest suture, yes, dentate suture, it is found at the our lambdoid. And shin dialysis, do you remember I told you? Yes, शिंदे का डायलाइसिस हो रहा है. दिस इज द वन फनी निमोनिक. कहाँ? नाक में, इन द नोज. देयर इज अवर rostrum of the sphenoid and our vomer bone. It is found in between the body of sphenoid and the vomer bone, which is important for the ENT. And then there is our synodesmosis. It had been asked recently in many exams, AIMS exam also, INICET, and your FMG exam also. This synodesmosis is found in between the radius and ulna. Middle radioulnar joint is our synodesmosis. Yes, our middle tibiofibular joint as well as inferior tibiofibular joint, that is our synodesmosis. Gomphosis is found in the gums in teeth. Gum, you can remember. Yes, the primary cartilaginous joint, it is found in between the epiphysis and diaphysis, while the secondary cartilaginous joint, very important topic, it is found at the midline. Yes, all the midline joints, they are example of the secondary cartilaginous except symphysis menti, which is classical example of primary cartilaginous joint. You can remember with the mnemonic SIM. S for symphysis pubis, I for intervertebral disc, M for manubriosternal joint. And then our synovial joint. Yes, ball and socket, I told you the mnemonic SHIT, shit. S for our shoulder joint, H for hip joint, I for incudostapedial joint is the ball and socket, and T for talocalcaneonavicular joint is the ball and socket joint, our INICET question pattern. Next, ellipsoid joint, elliptical. So I told you E is in this way, so you can make the W. Wrist joint is the ellipsoid joint. Yes, you can turn it into the M. The metacarpophalangeal joint is our ellipsoid joint, and yes, movement occurs in between the atlas bone and the occipital bone, atlanto-occipital joint. This is our yes movement, ellipsoid joint. Next, saddle joint. Don't forget this, root of the our thumb. The first carpometacarpal joint is the our yes saddle variety. Now remember, in rheumatoid arthritis, this first carpometacarpal joint is involved. Very important fact for their medicine. And then plain synovial joint, INICT pattern. Remember the our costotransverse, costovertebral joint, carpal bone joints, and the tarsal bone joints. They are classical example of plain synovial joint. Next is our hinge joint. Yes, hinge is door like. We are opening the door and we are asking to the guest IA. So your mnemonic is IEA. I for interphalangeal joint, E for elbow joint, A for ankle joint. And then pivot joint, don't forget C1, C2 joint. Atlantoaxial joint is the pivot joint, as well as superior radioulnar and inferior radioulnar joint. These are pivot joint. And last, the condylar joint, because they are the two condyles, so that's why the knee joint, yes, it is having the medial condyle, lateral condyle. That's why it is bicondylar synovial joint. Also the temporomandibular joint, it is having the right side condyle, left side condyle. So it is the bicondylar joint. So this is the our second video for the joint with the example. So thank you very much. God bless you all. Stay connected. All the best.